Did you know that 2 common food items could drastically affect your kidney health if you have diabetic nephropathy? While most people believe managing salt and sugar is the only key, there's some silent enemies lurking in your diet that might be worsening your condition. We'll explore that later, but first, were you aware that diabetes is the #1 cause of kidney disease? In fact, it's present in almost 45% of cases. And the longer you've had diabetes, the higher your risk of complications. But don't worry, we're here to uncover these hidden threats and arm you with 8 life-saving tips. And for those of you who stay with us, we've got an exclusive free gift that's going to be a game changer for your kidney health. Kicking things off with tip number 8, regular screening. Diabetic nephropathy can be sneaky and silent, especially in the early stages, but early detection can make your life much easier. You see, this condition occurs when diabetes damages the small blood vessels inside your kidneys. And your kidneys are like nature's best filtration system, working tirelessly to remove waste and excess fluids from your body. But when diabetes enters the scene, high blood sugar levels can strain these filters. As a result, proteins like albumin, which should remain in the body, start leaking into the urine. This condition is known as microalbuminuria, and it's the first sign that the kidneys are under stress. It's important to recognize these early signs, and when you catch them early on, you're in a position of strength. With the right interventions, you can either slow down or even completely stop the disease's advance. Next up, tip number 7 is all about the sleep apnea connection. Most of us associate sleep apnea with snoring or restless nights, but there's more to the story. Research has unveiled a strange link between sleep apnea and diabetic nephropathy. A study by the University of California delved deep into this connection. The findings? Individuals with both diabetes and sleep apnea faced a heightened risk of developing kidney complications. It's like a double whammy for your kidneys. But why does this happen? Well, sleep apnea can lead to repeated episodes of low oxygen levels during the night. This, in turn, can cause stress and inflammation, 2 culprits that don't play nice with your kidneys. So what's the takeaway? If you're battling diabetes and find yourself struggling with symptoms of sleep apnea, like loud snoring, daytime fatigue, or abrupt awakenings accompanied by gasping, it's time to consult with your healthcare provider. Addressing sleep apnea isn't just about ensuring a peaceful night, it's about protecting your kidneys from an undercover threat. Alright, let's tackle a cornerstone of diabetes management. Tip number 6 is about blood sugar control. It's not just about those sweet cravings or avoiding that afternoon energy slump. When it comes to diabetic nephropathy, maintaining stable blood sugar levels is non-negotiable. As mentioned before, elevated blood sugar levels, over time, can wreak havoc on the tiny blood vessels in your kidneys. This can damage the kidney's delicate filters, leading to a condition known as glomerulosclerosis. This means that the tiny blood vessels in your kidneys become scarred and thicken, and once that happens, the kidney's ability to filter waste takes a hit. A study by the Diabetes Control and Complications Trial found that keeping sugar levels close to normal reduced the kidney disease risk by a whopping 50%. That's half the risk, just by keeping an eye on your sugar levels. So what's the game plan? First, get acquainted with your target blood sugar range. Recent advancements, like continuous glucose monitoring systems, are making this task much easier. These devices provide real-time feedback, allowing you to make timely adjustments to your diet, exercise, or medication. But it's not just about the tech. Simple practices, like regular blood sugar testing, mindful eating, and consistent physical activity, can make a world of difference. Remember, every spike or dip in your blood sugar levels is a message from your body. Listen to it. Let's now shift our focus to tip number 5, blood pressure control. Similarly to high blood sugar, high blood pressure can also damage the filters inside the kidneys, worsening the effects of diabetic nephropathy. But controlling your blood pressure can make all the difference. A study by the University of Michigan examined people with high blood pressure. They found that those who were able to get their blood pressure under control reduced their risk of kidney disease progression by 70%. That's a staggering victory, and shows how important the relationship is between your blood pressure and your kidneys. Moving on to tip number 4, limit over-the-counter painkillers. Navigating the world of over-the-counter painkillers can be a tricky endeavor for anyone with diabetic nephropathy. While these medications offer quick relief from minor aches and pains, they might be silently compromising your kidney health. Non-steroidal anti-inflammatory drugs, commonly known as NSAIDs, are a frequent go-to for many. From ibuprofen to naproxen, these drugs are easily accessible and effective. But here's the catch: regular and prolonged use can reduce the blood flow to the kidneys, potentially leading to kidney damage or even failure. But what if you're in pain? The key is moderation and consultation. Before reaching for that pill bottle, consider alternative pain relief methods like heat, cold, or even relaxation techniques. There are also alternative pain management strategies to consider, such as physical therapy, acupuncture, or even certain dietary supplements. If you do opt for a painkiller, ensure it's kidney-friendly and always stick to the recommended dosage. Paracetamol, for instance, can be a safer choice for many, offering relief without the kidney-related side effects of NSAIDs. In essence, while over-the-counter painkillers can be a blessing for immediate relief, they should be approached with caution. Next up at tip number 3, we have innovative treatments. Technological breakthroughs create constant changes within medicine. One of the most cutting-edge treatments is ACE inhibitors, which are medications specifically designed to protect your kidneys. They work by relaxing blood vessels, easing the pressure, and giving your kidneys a breather. But that's not all. Another class of drugs, known as ARBs, has also shown promise. They work in tandem with ACE inhibitors, offering an added layer of protection for those delicate kidney filters. A study from the Journal of Clinical Medicine highlighted the effectiveness of these treatments. Participants who were administered ACE inhibitors or ARBs showed a marked reduction in proteinuria, one of the key indicators of kidney damage. More importantly, a landmark study by the National Kidney Foundation found that ACE inhibitors not only slowed the progression of diabetic nephropathy but, in some cases, even reversed some of the damage. That's like turning back the clock on kidney health. Now, before we keep going, we'd like to thank you for watching with your exclusive free gift. This has been tailor-made for anyone struggling with kidney problems. Just click the link in the description below and start your journey towards better kidney health. Okay, coming in at tip number 2, of course, we have to touch on your diet. And first on the menu, sodium. Sodium is a mineral found in salt, sodium chloride. While it jazzes up our meals, too much sodium retains water, increasing the volume of blood in your arteries, and consequently, the pressure on those delicate kidney filters. The American Heart Association recommends limiting sodium intake to 1,500 milligrams per day for those with high blood pressure, a crucial factor in kidney health. But it's not just about cutting back on the salt shaker. Processed and packaged foods are often sodium traps. Consider opting for fresh and whole foods and using herbs and spices for flavor. A study from the American Journal of Kidney Diseases highlighted the profound impact of sodium reduction on kidney health. Participants who reduced their sodium intake saw significant improvements in kidney function and overall well-being. Secondly, protein. It's the building block of our body, but moderation is key. Overloading on protein can burden your kidneys. Balance is essential here. Embrace lean meats, fish, and plant-based proteins. Next up, one of the sneaky food items you might not know about. I'm talking about phosphorus. This mineral can build up in your blood when your kidneys don't work properly. When this happens, calcium can be pulled from your bones and can collect in your skin or blood vessels. Bone disease can then become a problem, making you more likely to have a bone break. Phosphorus is naturally found in many foods, including dairy products, beans, lentils, nuts, and whole grains. But here's where it gets tricky. Many processed foods contain added phosphates, which are harder for the kidneys to process. So how can you combat this hidden foe? Start by reading food labels diligently. Look out for terms like phosphate or phosphoric acid. These are clear indicators of added phosphorus. Next, consider incorporating foods that are lower in phosphorus into your diet. Fresh fruits and vegetables are always a good bet. And if you're a fan of whole grains, opt for options like wild rice or bulgur, which have lower phosphorus content. Another mineral you may not be aware of is potassium. Potassium is involved in how muscles work. When your kidneys don't work properly, potassium builds up in your blood. This can cause changes in how your heart beats and possibly even lead to a heart attack. Potassium's found mainly in fruits and vegetables, as well as milk and meats. Too much potassium can lead to a condition called hyperkalemia, which can be life-threatening if not addressed. So how do we navigate this potassium paradox? Firstly, awareness is key. Recognize which foods are high in potassium and consider moderating your intake. Secondly, always be cautious with salt substitutes. Many of them use potassium chloride as a replacement for sodium chloride, which can inadvertently increase your potassium intake. Lastly, engage with a nutritionist familiar with kidney health. They can provide guidance on crafting a balanced diet that meets your needs without overloading on potassium. Dietary management isn't about deprivation, it's about wisdom and balance. By understanding how different foods interact with diabetic nephropathy, you can craft a menu that's both delightful and nourishing. And finally, tip number 1, embrace lifestyle changes. As we journey through the intricacies of diabetic nephropathy, it becomes evident that managing this condition isn't just about medications or specific treatments. It's about embracing a holistic approach, where lifestyle changes play a pivotal role. First and foremost, let's talk about physical activity. Regular exercise not only helps regulate blood sugar levels but also promotes healthy blood pressure, both of which are crucial for kidney health. Whether it's a brisk walk, a swim, or a yoga session, find an activity you love and make it a part of your routine. Stress, often overlooked, can be a silent aggravator. Chronic stress can lead to habits that are detrimental to kidney health, like smoking or excessive alcohol consumption. Find stress-relieving techniques that work for you, be it meditation, reading, or even gardening. In essence, managing diabetic nephropathy is a comprehensive endeavor. And remember, every positive change, no matter how small, is a step towards better kidney health. As we come to the end of our journey today, it's clear that diabetic nephropathy, while challenging, is not insurmountable. With knowledge, awareness, and proactive measures, we can navigate this condition with confidence and hope. Thank you for joining us today. If you found this video helpful, please like and subscribe, and don't forget your free gift in the description below. See you in the next video.